Hi guys, welcome back to my channel. If you're new here and you don't know who I am, my name is Nadine and I'm a registered midwife here working in the UK. So in today's video, I'll be exploring all the things that you need to know if you are planning to give birth here in the UK under the NHS. So my reasons for filming this kind of video is because I've recently went on a birth trauma workshop and I've had so much insight on what can contribute to women and families experiencing birth trauma. Is women and families basically having a misconception or a lack of understanding of what really happens within the NHS when they come in for their booking appointment or giving birth or in the postnatal period. So hopefully in today's video I will aim to answer majority of the questions that I've received over the years as I work as a midwife, and I see so many families having a difficult time within the NHS because of the lack of knowledge or they weren't prepared for certain scenarios. This has impacted them negatively while they were being looked after within the NHS. And my most important thing that you can take from this video is do your research when you are planning to give birth in a certain hospital within the NHS. If you guys have any more questions that you guys would like for me to answer, please do comment them down below. I'm more than happy to do a part 2 of today's video because I know there's a lot of questions out there and there's so many things that you guys would like to know before having your baby within the NHS. So I've listed each question in simple categories. So I have induction questions, I have birth questions, and then I have breastfeeding and baby feeding questions, I have postnatal questions, and I have general hospital questions. Let's start with induction. So a little bit of backstory about me. I'm a midwife in the NHS hospitals and I mainly work on the antenatal ward and postnatal ward, but I mainly focus on the antenatal side where I do majority of inductions and look after antenatal women. So that's just a little bit of backstory of what I currently do. So let's start with inductions and all the questions I constantly receive surrounding induction. How long does inductions take and how long will I be in the hospital for when I have my induction? The induction process has a lot of steps to it. The first step that we tend to use in the hospitals is the PROPES induction. So the PROPES induction is a 24-hour process. So the PROPES induction is like a pessarix and that stays in there for 24 hours. If you are a low risk woman, you have no other medical history, no other complications such as reduced movements or babies growing too small, too big, there's no other underlying factors, then you will come in for your induction and you will have an outpatient induction, which means you will come in for your induction, you'll have your PROPES inserted, and then you will go home and come back into the hospital after 24 hours. However, if you are someone that has a more high risk pregnancy, you have other medical histories, other complications, whether it will be you have a small baby, big baby, you have diabetes and your diabetes is controlled by medication and it's not diet, or other complications such as high blood pressure or things like that, then you will have induction as an inpatient because you will need to be closely monitored and we do not recommend that you will go home when we start your induction. So that is 24 hours for the first medication. After the 24 hours and you don't start contracting and there's no changes to your cervix, you will move on to the next medication, which is Prostin. So Prostin is a gel which also gets inserted vaginally and you will have that for 6 hours. After 6 hours, when we are reviewing the progress and if there's anything happening like you're contracting, your cervical dilatation has happened, then you will then continue to the next stage. However, after the PROPES and the Prostin and there's still nothing happening, you will then have a second dose of the Prostin gel. So that is 24 hours for the first medication, 6 hours for the first dose of Prostin, and then another 6 hours for the second dose of Prostin. So that's basically 2 days for your induction process for the first step. However, every hospital does things differently. Some hospitals may start with the Prostin gel. They may not necessarily go for the PROPES initially for 24 hours. Some may just do the gel. Some may also do other methods such as the misoprostol, or they'll use the balloon induction while you are in hospital. So just look up at what happens in your hospital and what kind of methods that they use when it comes to inductions. So please be prepared that you will stay in hospital for a long period of time if you are starting your induction. Please come prepared that you may not be sent home if you are also low risk, because once they start your inductions, things may change. You may no longer suit the criteria to go home and have an outpatient induction. So just be mindful of how long things take for your hospital when you come to be induced. Do I have a say about being induced? So there's this big misconception that if a doctor offers you induction, then you have to have an induction. However, this is not true. They will offer you induction and explain the reasons that you need induction. However, that is ultimately your choice to decide whether you are being induced or not. Women feel like when the doctors offer inductions that they have no other choice but to go for an induction rather than go for other alternatives. There are other alternatives than being induced. Some women would prefer to just go for the cesarean section route rather than be induced, and that is totally your choice. If, for example, you've come into the hospital and baby is not moving well, or baby's growth is on the smaller side and they're offering you induction and you are not keen to be induced, then you can have the time to either decide to be induced or to decide not to be induced and have a cesarean section instead. Or if you still plan to have a vaginal birth and you want to give it all that you can to have a vaginal birth, then the option for induction is also available to you. But there's this big misconception that you have to be induced and you can't go for a cesarean section when induction is offered to you, and that is one big misconception. So the next question is, will I have one-to-one care during the induction process? So when we talk about one-to-one care, is having your own midwife that is looking after you and no one else. But for the induction process, you will be on the antenatal ward. You will not be on labor ward. Labor ward is where they provide that one-to-one care when you're in labor. On the antenatal ward during your induction, you will not have one-to-one care. At my hospital, we currently look after 8 women to 1 midwife. So we could have 8 inductions, ongoing inductions. So just be mindful of what they do at the hospital in terms of the ratio between midwife and women when it comes to inductions and what they do on the antenatal ward. I know another hospital close to mine, they have 6 women to 1 midwife. Another hospital, they may have 4 women to 1 midwife. So just be mindful that your midwife will also be inducing other women. You will not be provided one-to-one care when you are having your induction. So that is the answer to that question. You will not have one-to-one care while you're being induced. The one-to-one care starts once you're on labor ward. Will I get my own room while being induced? So this is one of the shocking realities. When women come for inductions, they end up being in a bay of 4 of other women as well while having their induction. So the answer to this question is no. You will not get your own room when you come onto the antenatal ward for your induction. So just mentally prepare yourself that you will be surrounded by other women and their family when you will start your induction. The only reason why you'll get your own room is if the hospital has a process where you can pay for your own room, but most hospitals don't do that anymore. They tend to keep those rooms open for infectious patients or mums that have twin pregnancies and they need that extra space. So those rooms, those private rooms, are mainly for those kind of patients. And I think that's one of the biggest misconceptions of when you start your inductions. People come onto the hospital and they're worried, like, how do I not get my own room? Can I be transferred to another hospital where I can get my own room? But the majority of hospitals here in the UK, they induce women on the ward, so you'll be with other women while you're being induced. So the next question is, once I start my induction, can I still have a low risk birth, i.e. a pool birth? It depends on the criteria of the birth center or the midwifery-led center in that hospital. For my hospital, they have a criteria. If we induce someone with the PROPES induction, they can still go to the birth center or the midwifery-led center to have their low risk birth if they have no other complications or no other medical histories, or their pregnancy is still low risk, and they can still go to the midwifery-led center to have a pool birth, for example, if they've just had PROPES. At my hospital, once you've had PROPES and prostin, then you are no longer qualified to go to the birth center or the midwifery-led center to have, for example, a pool birth, because once you have the prostin gel, you are now considered high risk and you will need to be monitored. So that's continuous monitored with the CTG on labor ward. So it all depends on the hospital that you are going to be booked at. So do your research. If you are booked to have an induction, ask your midwife, ask your obstetrician questions. Can I still have my pool birth, or can I still have a birth on the midwifery-led unit if I've had ProPES, or if I've had prostin, or if I need any other medical procedure in order for me to be induced. So be sure to ask your questions before your induction process so that you are better prepared and have a better experience. Okay, so that is all in terms of the induction questions, but I do have a video that I had previously filmed surrounding inductions, what happens, what they use, the process. If you want to go watch that video for more details and more information, please do go and watch that. I have linked that video in the description box below. So go watch that video if you would like to have more information surrounding inductions and what happens with inductions here in the UK. So we're going to move on to birth questions. So the first question is, if my water breaks, do I have to come into the hospital and will I be admitted? So big question. I get that question all the time when women ring up the ward asking for advice. So if your waters break and you are at home, you do have to come in just for monitoring so that they can keep a close eye on you and baby and make sure that everything is well. Baby's waters are clear, there's no signs of meconium, there's no signs of fetal distress. Then you will be sent home to come back in after 24 hours if you are not in labor. If your waters break and you are in labor and you come in, they will admit you onto labor ward for you to have your baby, of course. However, if your waters break and you're not contracting, which can happen, they will bring you in, monitor you, do a CTG or listen to baby, and then send you home so that you can see if you can labor on your own at home. Other hospitals may do things differently. So no, when your waters break, you don't initially have to be kept in unless there's other complications or unless you're in active labor. I can go into more detail about prom, breaking of water, the protocol, IV antibiotics, induction when it comes to prom women. If you guys would like that video, please do comment below. I'll be more than happy to film and give you guys more information surrounding water breaking, prom inductions, IV antibiotics, and all that good stuff. Okay, so the next question is, do I need antibiotics if my waters break? So if your waters break and it's not been 24 hours and you are still low risk, then you don't need antibiotics. After 24 hours of your waters breaking, then you will need to come into hospital and commence IV antibiotics just to protect baby from infection, and also yourself. They will commence you on IV antibiotics after 24 hours. But like I said, some hospitals do 18 hours after your waters broken, then they start you on antibiotics. But majority of the hospitals here in the UK and the NHS, they do 24 hours, then they start you on IV antibiotics. So you don't need antibiotics straight away when your waters break. You just need antibiotics when you are 24 hours, when you are prom and need antibiotics. So the next question is, do I need a cannula? So those that don't know what a cannula is, I will insert a picture here so you guys can get a better understanding of what a cannula is. And do you need a cannula if you come into the hospital, whether it will be for induction or for your birth? So it all depends on your medical history, your pregnancy history, and if you're high risk, low risk. Low risk women, they tend to not need cannulas. However, if you are being induced and there was a likelihood of you needing to go down to labor ward, they may need to insert a cannula. If you are prom and you need IV antibiotics, then they will need to put in a cannula. Another example is if you have a history of your previous pregnancy, there was complications, for example, you lost a lot of blood post-delivery, and they will need to insert a cannula in anticipation that you may need it after delivery if you do bleed out, for example, after you give birth. So a cannula is all dependent on you and your history, and they will just do a risk assessment to see whether you need it. But not everyone has a cannula as a standard procedure in my hospital anyway, but generically speaking, not everyone is required to have a cannula unless you need one. Okay, so the next question, which I get often, I see a lot of this discussion online. So many people don't understand the birth options when it comes to how they want to give birth. They don't understand that they can decide on how they can give birth. So I'm going to tell you straight, you can decide how you want to deliver your baby. So if you want to have a vaginal birth, you can choose to have a vaginal birth. If you want to have a elective cesarean section, elective means you have chosen to have a cesarean section under maternal request and there's no other medical indications, you can then have a cesarean section, which is a planned cesarean section. If you have a lot of trauma or you're very anxious of vaginal birth or or giving birth vaginally, you can opt to have a cesarean section. So please do not think that we are forcing you to have a vaginal birth. You can decide which route that you want to go to in terms of how you deliver your baby. However, some doctors may recommend a cesarean section depending on your history, your medical history, and what's been going on with your pregnancy. They will risk assess you and discuss that option with you. And with a vaginal birth is seen as the safest way to have your baby. However, sometimes vaginal births is not for everybody, and some women are terrified of having a vaginal birth. So there is an option to opt to have a planned cesarean section. Will my birth plan be respected? A lot of women are hesitant and scared that once they have their birth plan and they come into the hospital, whether they're being induced or come in established labor and go to labor ward, they are worried that their birth plan will not be respected or things in their birth plan will not go as they planned. So we as midwives and healthcare people, we want to go by your birth plan. We want to do everything you want to do in terms of what you planned for your birth and delivery. However, there are things that could medically pop up and go wrong. Baby's not happy, there's risks involved, and then your birth plan has to be adjusted depending on the current situation of what's been going on for your labor and your birth. For example, if you come in and you had to be induced and that wasn't part of your birth plan, now you are being induced with the ProPes and Prostin and you can no longer go to the birth center, and they will have to adjust a few things in your birth plan. So in your birth plan, maybe you wanted to go to the birth center and have a pool birth, but now that you were induced and you had Prostin and ProPes, now you need continuous CTG monitoring, but the circumstances may have changed in how or the place that you intended to have your birth. So things may change along the way, and it's absolutely normal for things to change. It just depends on the situation, on baby, on the capacity of the hospital. Sometimes the birth center is closed, there's no midwife to work on the birth center, and now you're having to give birth on the labor ward. They will still try and adapt and make your birth experience as close as possible to your birth plan. So yes, midwives, doctors, healthcare professionals, we want to respect your birth plan. We want to stick to it and give you the birth that you want. If you are open and open-minded in terms of things may change, you will have a beautiful experience, you will have a less traumatic birth. And then if things don't, great, then you have the birth that you wanted. And if things change, at least you are prepared that things may change and things may go outside of your birth plan, and they will introduce new plans depending on the new situation that they have at hand. So I hope I explained that to you guys in the best way possible. But let's move on to today's question. How will I know I am in labor? What are the signs of labor? If this is your first time, your first baby, then there are signs that you need to look out for that you may not be aware of. On the screen here, I'll put a long list of signs to note that you are in labor and what to do and what to look out for. What pain relief options are available? I'm going to break this down for induction. So inductions, the pain relief that are available to you while you are on the antenatal ward is the paracetamol dihydrocodone tablet, the Gasenair, which is the Entinox, the pethidine injection, and also you can, jump in the shower while you're on the antenatal ward to see if the water will also help you as a source of pain relief. On labor ward, you have the option of all those medications that I've just explained previously, and you will also have the option for the epidural. So the epidural is another form of pain relief that is available to you. As a postnatal, after having your baby, you will have paracetamol dihydrocodone tablet, ibuprofen, you will have morphine. So on the postnatal ward, we tend to not give you like epidural or anything, so it's just mainly oral medication. So postnatally, these are the medication that we will offer you. Can you get the epidural at any point? So this has been a long battle in my hospital in terms of at what stage can we offer epidural to women from the moment they start their induction up until the point where they are on labor ward. If you are being induced and your contractions have started and you cannot manage your contractions and you've tried all the other medication that we've offered to you, you've tried the pethidine, you've tried the Gasenair, you've tried the tablets, then you can request for an epidural, even if you are 1 centimeter dilated, even if you are 2 centimeters dilated, even if you are not in labor, you can have an epidural in my hospital. We can transfer you down to labor ward when you're not in labor for an epidural. So bear that in mind. Ask your hospital, at what point can you have an epidural? Do I have to be in labor to have an epidural, or can I have an epidural at any time? At my hospital, you can have an epidural at any time. Tell your midwife so she can transfer you down to labor ward and have your epidural. However, if capacity does not allow on labor ward, for example, they have so many laborers, so many postnatals still on the labor ward, if you want an epidural and they don't have that midwife to facilitate that for you, you may have to wait a while until that midwife is now available to start your epidural for you. But you can go down and have your epidural at any point during your induction, and also once you're on labor ward, you can have your epidural. Okay, so let's move on to the next section, which is baby/feeding. So the first question in that category is, do we provide formula? In my hospital, we do not provide formula. We recommend that the women that want to formula feed, that they bring their own formula into the hospital. However, we provide formula for, say for example, we have a very sick baby that is not feeding, that is having treatment, whether they're having phototherapy, they've lost a lot of weight, they're jaundiced, mum has not brought any formula, then we can provide the formula for those medical reasons and for babies that really need it. However, generically speaking, we do not provide formula for every baby that is admitted to the postnatal ward, or if you have delivered straight from labor ward and you want to formula feed your baby, then you will have to provide that and bring that in with you before you are admitted onto the hospital. And the formula milk that you need to bring is the ready-made formula. Some hospitals don't have the facilities for you to make the powdered milk, so bring in the ready-made formula. Ask your hospital the situation and what they do in terms of formula. Do your own research on the formula that you want to give to your baby, as we cannot technically recommend a formula or a brand. The parents have to do that research and decide which formula is best for their baby and the one that they want to give to their baby. So I hope that answers the formula question. It's a kind of question that I get often. So the next question, similar to the previous one, is do we provide bottles? And the answer to that is no, we do not provide bottles either. So you have to bring your own bottles, your own formula. In my hospital, we do have a sterilization pack where you can sterilize your bottles and then use that system yourself while you're on the postnatal ward and prepare your milk yourself. Ready-made milk, not powder, but we do have a sterilization kit. Some hospitals do, some hospitals don't. Do midwives wash the babies in the hospital? I do get this question often. Women tend to think that we wash the babies after delivery or on the postnatal ward, but this is old practice. We no longer do that here in the NHS. We do not wash the babies post-delivery. That is something that we no longer practice. Okay, so the next section is postnatal. Do I get my own midwife on the postnatal ward? This is something that is a shocker when women deliver and they are transferred from the labor ward to the postnatal ward, and the answer to that is no. You do not get your own midwife. Your midwife from labor ward does not follow you up to the postnatal ward and care for you. That midwife will deliver your baby and stay on the labor ward, and you will be transferred to the postnatal ward and be looked after by another midwife who works on the postnatal ward. And that midwife that works on the postnatal ward will also be looking after other women. In my hospital during the day, that midwife will have 8 postnatal women and 8 babies it will also be looking at. I think on the night shift they will have 12 babies and 12 mums in the night shift. So just be mindful that on the postnatal period you will be looked after by one midwife, but that midwife will also be looking after other postnatal women and other babies as well. It won't be one-to-one care. So the next question is, how quickly is being discharged home, or how quickly do I get discharged home? So that all depends on your history, your delivery type. If you had a cesarean section, they tend to keep you in at least a day or 2 post-section. If you had a vaginal birth, then they tend to discharge you home quite quickly, or they may keep you for just 1 day and then they'll send you home the next day. You can even go home the same day that you delivered if you had a vaginal birth that was non-complicated, no other concerns with you or baby has had all their checks, then you can go home the same day you delivered. So it all depends on the type of delivery that you had, if there was any complications, any further checks that need to be done for you and baby. So it all depends on a wider range of things. Okay, so the next question is, will I get a private room on the postnatal ward? So the answer to this is similar to the antenatal one. No, you will not be offered a private room on the postnatal ward. Some hospitals, they have some private room or single rooms where you can pay for, but there's not enough for every person. My hospital, we have 4 on the ward. My hospital, we no longer practice where people can book and pay for a room. You can only have a private room if you are a mum with twins, then you definitely need your own room. Or if you are a readmission, so you've gone home, you've had your baby, but you're coming back for further treatments, or there's more complications since you've been home, then that mum will have their own room. Or we have infectious patients that need their own room. For example, a woman has COVID or a woman has MRSA, and they will be put in a private room. So they tend to keep those rooms open for those kind of patients. So postnatally, you will not be offered a private room depending on your hospital, but majority of hospitals, they do not give you a private room. So just see what is the practice at your hospital, what kind of things do they do. Okay, so the last section is general hospital questions. First one in this section is, will my partner have a bed? And the answer to that is no, your partner will not have their own bed. So a majority of the hospitals, your partner will not be offered a bed as well, and they cannot sleep on patient's bed. For example, if the ward is empty, that is a big no-no, and I feel like a lot of partners think that's okay to do so when they come onto the hospital, but it's not okay. They may be offered like a pull-out sofa or a pull-out chair which turns into a bed, which my hospital are starting to get, but just be prepared that you may be sat on a chair, or there'll be no pull-out sofa, there'll be no bed for you, etc. It's something that is not guaranteed to happen while you're in hospital. So does this mean there is never one key person who follows you through your pregnancy? Do you see a new person for every visit and scan, and then someone completely different for delivery? This is actually a valid question, because some women have a very big misconception when it comes to seeing the same midwife throughout their whole experience within the NHS. So we do have case loading midwives within every hospital who follow you through the antenatal process, the labor process, the birth process, and the postnatal period. However, you may be seen by so many different people throughout your pregnancy. Antenatally, you may be seeing different antenatal midwife, although they tend to keep you as part of a team, so you see the same midwife constantly. However, if that midwife is off sick, if that midwife is on training, they have to go out for training, then you'll be seen by a different midwife antenatally. When you come into hospital and you are on labor ward, you will get one midwife for 12 hours, because obviously our shift work is 12 hours. After 12 hours, they will do a shift change and you'll have a completely different midwife. And if that midwife that you first had is not coming back to work until, for example, next week, then you'll be seen by a different midwife, which will be someone completely different for the 3rd time. Postnatally, we don't move around with the women, so the women that looked after you on labor doesn't move up to the postnatal ward to look after you. You will go on the postnatal ward and be looked after by someone completely different, and that person is only there for 12 hours. After 12 hours, you will also get a new midwife that will look after you for another 12 hours. Be prepared to be looked after by different people the entire time, so just be mindful of that. Will I get a bed on labor ward quickly when I'm in labor? If you're coming to triage and you are in labor, they will get you a bed on labor ward very, very quickly, because you can't stay in triage to have your baby. If you are on the antenatal ward and you are being induced and you're now ready for labor ward, if they don't have the capacity, or if they need to transfer someone, you might be waiting a little while until they transfer you. NHS hospitals at the moment, they are very, very understaffed. They don't have a lot of equipment. Things tend to move a lot slower, and women need to understand, if you are on the antenatal ward waiting for a bed on labor ward, it may take some time due to other factors: lack of staff on labor ward, lack of beds on labor ward. The labor ward is at full capacity and they cannot take anyone. But just be mindful that there are other factors out of the midwife's control that can delay you going down to labor ward quicker and swiftly in a timely manner that you need to go down to labor ward. So just bear that in mind. Can I choose to have all female staff who care for me? And this is a question that I get a lot. When you come into hospital, just be mindful that we have female midwives, we have male midwives, we also have male and female obstetricians, we also have male female consultants, we have male female nurses. It's a mixture of male and females when it comes to the people that provide care. If you're someone that is very adamant that needs a female to examine you, for example, they may try their best to give you what you want in terms of having a female examine you, for example. However, if it's just an obstetrician that is a male in the hospital and there's complications and they need to intervene, just be mindful that that is literally the only person that's there that's going to help you when you need the help and assistance. If you need an instrumental birth, the midwives don't do instrumental birth, so it's down to the obstetrician. If the obstetrician is a male, then that's literally the only person that can do the instrumental or the cesarean section for you. So just be mindful that there will be male and female staff that will look after you. They will try and their best to kind of give you your best wishes, but if they can't, then it's out of their hands, so to speak, because that's literally the only person there that can provide that service. Next question is, if I'm diabetic, do I need to bring my BM monitoring machine? Yes, if you are diabetic and you've come in, for example, for your induction or for your labor, please bring your machine to do your blood sugar monitoring. Bring your medication. If you are on metformin or insulin, bring your medication. Also, if you have any other underlying medical history, maybe you're epileptic or you have thyroid problems and you're on medication for it, please bring your medication when you come into the hospital to be induced or have your baby. You will need to keep checking your blood sugars while you're being induced. Nothing changes from when you are at home. Still check your blood sugars, still take your metformin and your insulin as you were at home. However, we can still provide, if you forget, you come in an emergency situation and you don't have your equipment, you don't have your medication, we can provide, we can get from pharmacy, we can do your blood sugar monitoring, but it makes your life a lot easier, makes everybody's life a lot easier. If you have your own machine, your own medication, things will just run smoothly and there'll be things that won't be missed. For example, if your one midwife is delivering someone unexpectedly next door and your blood sugar is due to be monitored, you can just quickly check it and let the midwife know after she's done with the emergency. Or if your insulin is due and your midwife is with another patient and she has a pathological CTG and she's dealing with that with the doctors, and your insulin is due, rather than you sitting there waiting for your insulin and you need it, you can just take your insulin as you would at home, and then when the midwife comes, you let her know that you took your insulin because this was your reading, etc, etc. So that is it for this part of the Q&A and all the questions that I had noted down. So those are the questions that I get constantly, that I see and experience constantly as a midwife within the NHS. So I hope it has given you guys some insight on the realities of giving birth or being cared for on the NHS. If you guys have any further questions, you guys would like me to do a part 2, please do comment below, send in your questions. Let me know if you guys want me to do a part 2. But yeah, my main reasons for doing this video is to highlight that the biggest reasons that women have a traumatic birth or a traumatic experience within the NHS is because of the lack of information that they have. They're not informed, they don't do their research, they go into the system blind with no expectation, and they kind of get thrown a lot of information, or we need to do this, or we can't do this, or you need to have this. If you go there prepared, fully equipped, then you will have a good experience, a perfect time, and you will know what is expected of you, what is expected of the midwife, what is expected of the doctors. You will know what to say no to, what to say yes to. You will know your rights. You will understand what is being offered to you and why, what you can and can't do, what you should do or shouldn't do. Then your life will be a lot easier if you knew everything that you needed to do and you were better equipped when you go and have your baby on the NHS. But that is it. I hope you guys have enjoyed today's video. Please do give this video a thumbs up as it reaches a wider audience, and I want so many women and their families to see this video. It may help others, so please do give this video a thumbs up. Also subscribe to the channel if you guys are interested in joining my YouTube family. I'll see you guys very soon in my next video, which will hopefully be very soon.